The guidelines that we really are following are the ACC-AHA guideline, American College of Cardiology, and the American Heart Association guidelines. Those first came out in December 2013 and they were published in full in January 2014. And those guidelines recommend determining which statin to use based on someone's 10-year cardiovascular disease risk. So if someone already has ASCVD, atherosclerotic cardiovascular disease, then it's recommended that the patients take high-intensity statin as long as they're under 75 years of age. If they're over 75 years of age, then a moderate intensity statin would be recommended. This guideline also recommends statin intensity based on diabetes, high LDL over 190, as well as cardiovascular risk. And so those four patient populations have very specific recommendations based on age and their disease states. The other guideline, the NLA, the National Lipid Association guideline, that guideline actually has recommendations based, and that's really not a guideline, it's actually more just recommendations from a society, and it recommends to have LDL goals for each subset of patients. And that's how we used to do it before these new guidelines came out, but currently LDL doesn't have a lot of evidence to support treating down to an LDL goal, and so that's why the ACC-AHA guidelines kind of went away from an LDL goal, and that really is the main difference.